So, hello guys, welcome back to Medical Coding Club. So, today I'm going to give you a few updates regarding ICD-10-CM. So, as you all know, ICD changes will happen every year on October 1st. Okay, so we are aware that already the changes has taken place on the October 1st, 2024, and it will be effective up to September 30, 2025. Now, from April 1st, we do have slight changes, like minor changes. So, we will see what are the changes that are going to come from April 1st. Okay, so why they are doing this in middle update is because sometime some correction will be there, and also any kind of emergency guideline issue, public health emergencies. Okay, so because of some what to say, some agenda will be there, so based on that they will release minor updates in middle. Okay, so the CDC, that is Center of Disease Control and Prevention, they have released the new PDF, so you can go through when you have a free time. And here the major change we have that we have to discuss today, and also which is regarding guideline. Okay, so we will see the changes and we will understand how to code. So from April 1st, you need to follow this coding guideline, that what I'm going to discuss now. So see here, this PDF is effective from April 1 and to September 30. Same way, we have already have the PDF which is October 1st to 2024 to September 30, 2025. So first, the coding guideline changes is happening in the COVID uh, scenario. So we'll see that. So for asymptomatic individual, so you can see here what is the guideline that we have in our 2024 changes. Okay, so they say for asymptomatic individual who test positive for COVID-19, see the guideline. So this guideline is regarding public health emergency. Okay, PHE. So here it says, like, once the even though the patient is asymptomatic, but the lab test positive is there, the patient can still transmit the virus. Okay, so that is what the PHE was telling. So based on that, what we were doing, if the patient is asymptomatic, like patient has no symptom, then also if you get a lab result as positive, you are going to assign U07.1. Okay, so in according to 2024 coding guideline. So what we have now from the April 1st, that the revision what happened is, so we will see the revision. So you can see from this PDF, this is effective from April 1st, 2025. So you can see it says asymptomatic individual who test positive for COVID-19. For asymptomatic individual who test positive for COVID-19 and there is no provided documentation of diagnosis of COVID-19, query the provider has to whether or not the individual has COVID-19. A false positive laboratory test is possible, and it's provider responsibility to confirm the diagnosis and document accordingly. So here, you as a patient is asymptomatic, and if the lab turns out positive, you should look for the final diagnosis. Okay, where as lab test is positive, provider has to document patient having COVID positive. Okay, the COVID-19 infection is there, that documentation should be given by provider end. If the doctor is not saying anything, you have only the data regarding lab test which is positive, then you may have to query the provider. Okay, you cannot assume, you cannot assume and go ahead and bill the COVID-19, or you cannot ignore also. What to do, you can query the provider. Okay, you can put that claim on hold and query the provider. Here patient is asymptomatic and patient lab turns out as positive, so but you did not mention any final diagnosis or a confirmed COVID-19 diagnosis. So what we have to consider here, so if it is a true laboratory result, the doctor or a provider, he has to give the report saying that yes, confirmed diagnosis is COVID-19. If the doctor says no, patient was asymptomatic, maybe it's a false test. And if he is deny that the COVID-19 is positive, then you can just go with the suspected code. Okay, exposure, suspected exposure code is there, no, that you can utilize. But here, as you know, the difference here is previously you were not waiting for the provider diagnostic statement. Based on the laboratory, you were assigning U01. But as of now, in the current April 1st coding guideline, you need a provider statement where he must document patient is having COVID-19. Okay, that report is mandatory. Only by seeing lab result as positive, you cannot assume the final diagnosis. Okay, so that is the major guideline revision happened for the year 2025 from the April 1st. So this will be effective from April 1st, and you can just go through this coding guideline. And next, and also there are some changes in the tabular list and also